In today's Women's Care Wednesday segment, we are back with Dr. Anna Wouters from Women's Care Florida to finish our conversation about common pregnancy questions. Good morning.
Good morning. Thank you.
I say finished, but we're still not going to probably go into everything that I'm sure you get asked all the time, but we'll attempt to do some of the bigger ones, the most common questions.
Okay.
Number one, and it's funny, I had an issue with this my first time around being pregnant. I haven't yet, knock on wood.
There you go.
Indigestion, though, it can be extremely uncomfortable. How common is indigestion with pregnancy?
Very, very common. I tell women if you're having it more than twice in a week, you probably need to be on a medication and be coming in and talk to us.
Okay. Can it cause damage? I mean, is it something
to the esophagus? And so, you know, if you're popping Tums all day, come in and talk to me.
Okay. Does it happen more, I would assume, maybe later in pregnancy when you tend to get bigger? I mean, or is it?
It can happen anytime from the increase in estrogen that you experience early in the pregnancy, but you're right, as the baby grows, it does tend to put more pressure and it's more, yeah.
Okay, so if it's happening more than twice a week, go ahead, bring it up to your doctor,
yes,
do something about it. All right. Okay, I've always said this about pregnancy. I love my pregnancy hair. It seems to be thicker. Am I just imagining things?
No, you're not imagining it, but it's not true for everyone.
Okay.
So your hair grows at different lengths and different times, and each one is on its own little wavelength. When you get pregnant, they all fall into sync. So either it will all grow and become thick, or will all fall out, and I don't know which one you'll be.
So that was my, because then after the thick hair, which is nice during pregnancy, mine tends to fall out afterwards.
Correct.
Is that pretty normal?
It is very normal, but it'll go back to being normal within a few months.
Okay, but you say people can actually lose their hair in pregnancy, though.
In the beginning, right. So it's kind of like what you have at the end. They'll have it at the beginning, and then it'll grow in thicker throughout the pregnancy.
Kind of nice, though, to get that out of the way.
Right.
Okay. All right. Is it safe to travel? What say you, doctor?
So, yes, it's safe to travel up to about 36, 37 weeks. Each group will have its own.
Far. Okay.
Yeah, they'll have their own practice. The airlines are actually more stringent, so check with your airline before you buy the ticket.
Okay. Well, you hear all the time sometimes that babies being delivered on airplanes. I can see where they're like, wait a minute, we
don't like that.
Yeah. Okay, this is one you're going to make me blush. Is it okay to have sex when you're pregnant? I'm sure you actually say you get this a lot.
I get this a lot, and I get it a lot actually from the husbands who come to the appointment. I think they come just to ask, but the answer is actually yes, it's totally okay. In most pregnancies, in a healthy, normal pregnancy, it is.
Okay.
There are exceptions, and of course your doctor would tell you if you were in one of those risk factors.
Okay, but you were saying a lot of times husband asks, like, am I going to hurt the baby? There's this fear of that you're doing something wrong and going to hurt the baby.
But you're not going to hurt the baby, and actually if the mom is enjoying it, the baby will get those enjoyment hormones first. So baby's okay.
Good to know. All right, and then let's talk about, this is a serious issue that I'm glad we're bringing up here as we get ready to close. Baby blues. How common is it? I mean, again, I think there's always this idea of how happy and how everything is supposed to be perfect, and I think it's frustrating for moms.
It is. So women have this expectation they're supposed to be happy and perfect, and they, build up motherhood in their mind. And the truth is, most women will experience some form of baby blues in the first few days after delivery.
And I'd imagine that's because of changes in hormones going everywhere.
Hormone fluxes, and it lasts for up to 2 weeks, and that's normal. If it's lasting beyond that or symptoms are more severe, it's not normal, and you need to come in and see us, but it is common. And so 1 in 6, 1 in 10 women, depending on what you read, will experience some form of postpartum depression, which is an issue I'm really glad we're bringing up because it is important.
And you were saying, because I was asking, let's say, I mean, if you had it in pregnancy 1 and you're pregnant your second time or whatever, does that have any kind of inkling if you were going to be more prone to that?
So yes,
another pregnancy?
If you had it your first pregnancy, you are a little more likely. Same thing if you had a depressive episode in an earlier part of your life for any reason, you're more at risk.
All right. Well, as we get ready to close here, again, doctor, if people have any questions, which again, I know we're just scratching the surface because pregnancy is not an easy time and there's always questions, what would you have them do?
I would tell you guys, write them down, bring them in a little notebook to your doctor's office. You can have the answers and the questions all in one place. And then with pregnancy brain, you're going to forget if you try and not write them down.
So true. Thank you so much for joining us. We really appreciated your time and the conversation this morning. And of course, there is the contact info to get a hold of this doctor or any of the other with the team at Women's Care Florida.